Hello. I know this is kind of funky, so you can see my little band-aid, and then that's kind of puffy, and I have one right under here. She said my eye might be puffy. So today I had the day off from work. I had 2 doctor's appointments. I've been doctor appointment happy lately. So let me back up. So since my last video that I had done on my breast cancer journey, I've had 3 appointments. So one was with the breast plastic surgeon, and I'm about, right now I'm 4 weeks out. At the time it was like 3.5 weeks, and everything's healing very well from when I had my tissue expanders replaced with my implants, or taken out and my implants put in. Everything's looking well, and I was thinking of doing a recording before when I had that appointment, but when I was done with the appointment, I was just kind of feeling So I went into the appointment and wanted to ask him about if they could have put like a bigger implant in. I mean, it's pretty big, but it feels like there's loose skin on the top of my breast. That's kind of weird. And they also, so my surgery's been now 4 weeks ago. They had done liposuction for my stomach. It doesn't make a whole lot of difference to your stomach because they only take what they need, and they take the fat and grind it and do different things with it and then put it into the top part of your breast to help with the slope. So I feel like this top part, it looks beautiful. It looks amazing, but it's very, very thin. Like the skin is very, very thin. So you can really feel, this is kind of weird, touch my boob, but you can really, really feel the implant like right there. So there's very, very thin layer of skin. And my implants are over the muscle. Some people get them under the muscle, but they're over the muscle, and it's very, very thin. So I'd asked him if there's just like extra skin here and they could have put a bigger implant in, or what the case is. And I felt like I burst his bubble. He was very, very proud of the work he did. It looked beautiful. I was talking to a couple of people over time too, and I'm like, it's just going to take me some time to get used to. By the way, I'll explain this and this here shortly. So I think it's just going to take getting used to. They're definitely smaller. Anything's going to be smaller than what I had. They look great, but it's a different body. Like for me, it's very hard to explain. And I even talked to somebody who, was smaller chested and had gotten implants, not cancer related, but had gotten implants, and they were saying that it was a weird adjustment too to get used to having, something bigger there. So it's just kind of weird. And I go back to see him in about 2.5 months. And there's this thing that people call drop and fluff or drop and settle. So basically, after a couple months, your implants are supposed to like be more settled, and they can change and look a little bit different. He was telling me he didn't feel that was going to be the case for me. They weren't going to look drastically different or anything. He did find one piece. There was like a little nub thing that he was like, I could, not shave it off, but like, I don't know, contour it a little bit better. I don't know, that's weird. So he's like, but they're really, really good. And with my sports bra on and just halfway zipped, he's like, you can't really even tell that they're implants. They look very, very natural. Yes, they do. They look great. My scars are healing fine. And so I need to figure out, just over the next couple months, see how I like them, how I can get used to them. I also said I need to get back in, now that I can get back into more exercising, to kind of get this belly down. A lot of people, when they have bigger chests and you lose your chest, you didn't realize how big your belly was. So the liposuction helped just a tiny, tiny bit. I couldn't bribe him to do it anymore unless I paid a few $1,000 out of pocket. Didn't have that after paying all these stupid copays and out of pocket and all that crap. So I said maybe, over time as I do my exercising and I, get into my routine and everything, maybe it'll just feel different. So he said my options really are I can leave as is, or if I wanted to, we could do more fat grafting to help to put in between that layer of, the implant and the skin. Implant something else in the skin. I can't remember what that was called. But he said to help build that up a little bit more. He said we could put more fat grafting in there, or we could go in and put bigger implants. He did say with the implants, he's like, you can only go to the well so many times, so he's not going to open that up. I have the scars straight across on on both sides of my chest. He's like, you don't want to open that up too many times. So he said we could do that. I do have room to go bigger. I don't know if that's what I want to do. So I'm going to wait, see how I feel, how things look, and, all that kind of stuff, and then go from there, and not make that decision right away. So the other appointments I had this morning, it's Friday, June 19th, and I went to the gynecologist, and so I went to the gynecologist, and I couldn't remember. I knew it was last year this time that I had my annual exam. I did not remember if I was having my annual exam or I was going in for a consult, like follow-up from when I talked to him quite a few months back when I found out I first had cancer and was talking to him about things and, birth control and what I could do and all that kind of stuff. I was ready in case I did have an exam. That might be TMI. So I went in there, and it was funny. The nurse was doing my blood pressure, my weight, and I was like, am I here for an annual exam? Like, I just want to be prepared before I walk in the room. She said, yes. And I said, okay, I want to ask some other questions. And I think I've gotten down the 2-second, 5-second. This is what I've gone through in the last 6 months. So to explain it to a nurse right away. So I explained it, really quickly, and this is what I want to talk to him about. So my oncologist, I had started in the beginning of April monthly shots called Lupron. And it is to suppress my ovaries because my ovaries, with secreting hormones, my tumors in my chest were 100% hormone fed. So we want to get rid of all hormones out of my body as much as we can. So the shots are helping to suppress my ovaries until the time that I have surgery. Some women who are still in like childbearing years, I know I'm not going to have a kid. I have not been successful in us, thinking we might in the past and whatnot. So I just know that ship has sailed. I'm fine with it. But some women just do the shots until they're through a certain stage, and then when you stop the shot, your ovaries can start working again. So it can be a temporary fix. My oncologist wanted me to start the shots because he wanted to see how my body would react to it, to make sure that there wasn't anything harmful that happened or the side effects weren't too, crazy, before I go to have the surgery to remove the ovaries, to make sure he had a good idea how my body was going to react overall. Because the last thing you want to do is rush into the surgery and then your body goes crazy. I go crazy, and you're trying to figure out how to control it at the moment. So I think that was a smart move. So I went to my gynecologist to talk about getting my ovaries removed. I was prepared, though, to go into that discussion, thanks to a lot of the private Facebook groups I'm part of that have women who are going through or have been through breast cancer. And I was ready to talk to him about, can I go the route of a full hysterectomy? So a full hysterectomy would take my uterus and my cervix, if I'm saying this correctly, my uterus and my cervix. And he was talking about taking, in addition to the full hysterectomy, take my ovaries and my tubes, my fallopian tubes. So I was worried that I would go to him and start telling him this, and I'm not BRCA1, BRCA2 gene mutation, which a lot of times if you are, you're more susceptible to uterine or ovarian cancer or, cervical cancer. So they're more willing and ready to jump in and do that. So I have not identified a gene mutation. There was like 26 they tested, including the BRCA genes. So I was a bit worried that he might say, no, like, we just want to take your ovaries. Because even when I went to see him, when I first found out about my diagnosis and before I had my mastectomy, he didn't want to go in and take anything out because he didn't want to put me in menopause. And he didn't want to put me in menopause because he couldn't treat me with hormones. So we knew enough at that time about that. He's like, I don't want to put you in menopause. I can't treat you with hormones. Well, my oncologist is like, the gynecologist doesn't have a say in this. Like, we need to shut down your ovaries. We need to get rid of anything that's causing these hormones. Like, and I'm 100% on with that. So when I went to him, I wasn't sure how he would react. He was 100% on board with me. Let's take it all out. Why come back, a year or 2 years later or anything like that and have the worry that something could happen? In addition, he also told me that the hormone blocker, which I take a hormone blocker pill every day, and it will be for 5 to 10 years. That hormone blocker increases your risk of uterine cancer. Mother trucker. Like, you can't, it's like one thing leads you down to a path to something else. So, like, heck yeah, get that thing out, you know? So going in and getting the whole kit and caboodle, he does laparoscopic. I forgot to ask about the stay in the hospital. I've heard a lot of people so far they stay one night in the hospital and go home the next day. And hospitals are relaxing a little bit more in Ohio, so hopefully that means, you know, Tony can be with me and that kind of thing. Trying to think of what else. So he was good with that. He had said that I asked him, so I'm only 4 weeks out from my last surgery to getting my implants. So I said, how long do I have to wait? I said, I'm kind of maxed out of my out of pocket on the insurance, so I want to get whatever I can get, you know, the free plan, as my friend had mentioned to me. See how I can do that. I said, can we get this done this year? Absolutely. I said, okay, how long do I have to wait? He goes, you have to wait 4 more weeks max. He said, I would prefer 8 weeks from surgery. That would be the earliest that he would do it. And he does have availability that he could put me in. He said the surgery takes like 45 minutes to an hour, if that, to do all that. He's like, and if I'm already in there getting your ovaries, why not take it all? Totally agree. Thank you. I could have hugged him, but he was wearing a mask and he probably would have told me to get out of there. But he's a great guy, and I trust him. He's doing laparoscopic, so it will be minimally invasive. A few marks, you know, on your tummy, around your belly. The recovery, I've heard mixed reviews on it. 2 to 3 weeks, for the most part. So, thankfully, with my company, I have chosen to work from home for the rest of the year. But I know, and thankfully I have a lot of vacation time. So I told my doctor, I said, I've been using my vacation time for recovery basically all year. So, I will be covered. So I just need to figure out, you know, what that looks like and make sure I'm prepared for all of that. Mentally, I am. Let's get it done. Let's roll. That's my thinking on it. I don't want to have to worry about it. I did ask him, do they test all of the, tissue? And he said yes. Because just in the back of my mind, I've had like ovarian cysts before. I've had one burst. I've had issues just in general with some of my stuff, my lady parts, TMI. So I just want that will be helpful for me to know. Like, did they find anything, and were there early stages? Were there the abnormal cells, like in my left breast that didn't have the cancer, the tumors? There were abnormal cells starting to form. So it will be interesting to kind of see that. And hopefully, regardless of whether there is anything there or not, you know, there's not going to be a chance to be anything there later after that. So I'm very, very excited about that. I want to get that on the road, get ready to go. So as far as my face, now that you've been staring at me with my Band-Aid. So also I want to tell you, these round Band-Aids, they look huge on my nose. I would laugh every time when I had my tissue expanders in my chest and I would go into the doctor, the plastic surgeon, every 2 to 3 weeks, and they would fill. They would do there was a port. It was like a magnetic piece, kind of like where your nipple is for you. And there was a port that was magnetic, and so he would take a thing and he would stick the needle in it. Well, until like the last couple fills, I didn't have feeling. But then the last couple fills on one of my sides, I was like, ah! So they would put saline in them and start to expand that skin and that tissue and everything. So, and when he finished that, when he took the needle out, there might be a little bit of blood or something. They took one of these round Band-Aids and they would put it on. And I laughed every time, and I know other women in my Facebook groups that I'm part of would too, because I'm like, oh, I got like little nipples, like my Band-Aids. So I told you I need a sense of humor throughout all this. So for my face, what I did is I have had moles in the past. I had one, you can kind of see the scar, get up close. See a little bit of a white scar. I had a mole here ever since I was little up until 5-10 years ago, maybe around 10 years ago, closer to that. I went to the doctor and I hated it. It drove me nuts. I did not feel like it was a beauty mark at all. It was just annoying. So I had her remove it, especially with the history of cancer in my family. So she removed it and they sent it off to be tested. It was benign. I was fine. Quite a few years later, I went back because I had on my scalp a big, I never saw what it looked like. I could feel it, and it was big and it stuck out, and it just, I don't know, there was something about it. It was different than this one. It was more worrisome to me. So, gone to the doctor and she had removed that and it was benign. Everything was fine. So, in the last year, on my nose, just in the last year, I've had a spot pop up, and it wasn't like a raised, but it was white. It was, so I didn't know if it was a white mole. Somebody thought it was a cyst. Like, I had taken some pictures of it. So I was a little bit worried about that, and of course I had to Google white moles and scared the crap out of myself. But not only that, I was concerned about it, but especially since April when I started taking the hormone blockers and the shots, I had gotten right here and right here, like right under my eyelid. Yeah, right there. You can see they're a little bit red. So I had gotten these two, had popped up just in the last couple months. And this one was more white. This one was a little tan colored, not too bad. But this one I was putting on makeup one day, and it was like I could feel it. It was a little bit raised. It was white, and of course I had Googled the white moles, scared the crap out of myself. So I thought, you know what? With everything else I'm going through, with my free healthcare plan that I'm on right now, I need to go see a dermatologist. Like, no ifs, ands, or buts. Like, I just get it checked out, you know? And of course, I'm worried about anything and everything anymore. I totally get cancer survivors, any little ache or pain. I try not to be a pain in the ass to doctors, but I also want to take care of myself and be careful. So I went to a dermatologist, haven't been for a long time. My family doctor actually did this one and the one on my head. So I went to a dermatologist this afternoon and told her about it. She looked at it. She used this really unclear terminology and explained to me what these were. I was like, what? Like layman's terms. And she said, she called them wisdom, I think they're wisdom moles is what she referred to them as. I was like, wisdom, what? She's like, with age. I didn't say anything to her, but I know she was saying you're getting old. So she's like, we can freeze those. So they basically take the canister and they had like covered up my eye and it was holding my skin and they were spraying that, I can't remember what it's called, it's like a frozen stuff on it, and it burned. It was burning it. She said, so over the next month, you're going to see those start to fall off. And she's like, they would be benign, you know, the way they look and everything like that. With this one, the white mark, she didn't really call it a mole. Again, she used some terminology and I was like, but she said it was different than these. And she said what I can do with that one is I can scoop it, gross some of you out. She's like, I can scoop it and send it for a biopsy. Take 2 to 3 weeks to get the results. My guess is that it's going to be benign just like this was, I'll be good. From the looks of it and everything I explained to her, it hasn't changed color, it hasn't raised, it hasn't bled, like all that kind of stuff. It doesn't sound like it would be cancerous. I do have an aunt that passed away from melanoma. I do have, you know, a family history of cancer, gene mutation. I did not get, they only tested 26. There could be a zillion others that they haven't figured out yet either, too. But she also was kind of looking around at my face, and she saw this, which I now see the mark, and she asked me about this one. Get a little closer there. So this one I have had for quite a while, and she's like, what's the story with that? Like, and I was like, well, I said, I remember a couple years ago, I thought it was like 2 years ago or something. I remember it would grow. It was kind of like a mole that stuck out, and then it felt like a scab or something, and I might like scratch my head or something and it would bleed a little bit, not like significantly or anything. And she's like, if you see that start to change or grow, grow, bleed, change color, like any of that. She's like, let's do this. She's like, I don't know that we would freeze it. We might scoop it like we did with this one and check that one out. She's like, that. She's like, she's like, I want you to be aware of that. So good to know. Um, so that's the story with my Band-Aid. I'll probably take it off here in a little bit, but it was funny when I looked in the rearview mirror when I got in my car, because it made me think of when I would get my fills, and I was like, oh, I got little nipples there. So some of you might appreciate that humor, especially on a Friday. So I have had a fun-filled week or so with several doctor's appointments and good things. Healing nicely, healthy, trying to get used to this body, this new normal body, and if I want to work on any other changes, and that will help me feel more like me, I guess. I don't know. I think I just need some time. And then trying to make sure I take care of myself with everything else. And I would be really interested to hear from you ladies who have had a full hysterectomy, laparoscopic, and if you've had like ovaries and tubes removed also, just your experience and how you felt, how long you might have taken off work, and the recovery, that kind of thing. So I am very interested in that. So I hope you're doing well, and I'll talk with you later. Bye.